Okay. Have you ever had an experience where your body felt like it was not doing what you wanted it to do? Whether it's your arm, your hand, your ribs, your ass, can I say ass? Your legs, just everything, just things are just not really working out for you. You're just trying to live your daily life and you have pain or things are just not moving. I had this experience in phase 1 of pandemic when, like everybody else, to see my friends, to get exercise, I was walking several miles a day outside. Just not my normal thing to do. So I'm with my friends, we're going for walks, miles and miles and miles. And on day 4, I was in pain. My hip is hurting, my foot's hurting, my back's hurting. And I'm like, what the heck is happening here? This is just not okay. And I started thinking, is my body working against me? Because what's better for my body than walking outside for hours every day? And this became kind of ironic to me because in actuality, I'm a physical therapist who has spent the entirety of their 31-year career, I went to school when I was 7, learning how to help people be better and bring them out of pain. I've worked with thousands of patients. I have taken 100 classes over my PT degree with the top people in the world and studied manual therapy with them. I have 3 clinics in 3 different states. I teach classes all over the world. And yet here I am thinking that my body is working against me. So here we are in pandemic, and I can't go into my office to get treated by my staff because we're not crossing paths. I can't go anywhere to get treatment because nobody's leaving their house. So I started thinking, what if I treated myself like I treat my patients? And I started thinking to myself and reflecting on what has happened to me and my body and my life that could be resulting in the pain I was experiencing from all this walking. So I remember that years ago, I was rollerblading. Has anybody rollerbladed, big rollerbladers? Yeah, it's hard, okay? So one time I fell right on my butt, like totally all the way down to the ground. My feet just went out from under me, right on my butt, and I literally couldn't walk for like 3 days. It was terrible. Now this was years earlier, but what I know from working with my patients is that when we work with people who are having pain and issues, whether it's pediatric, geriatric, we treat everything from torticollis to stroke patients. We look at the body as a perfect system. Whatever's happening to the body is there because of things usually that have happened to the body in the past. Everything should make total sense and nothing is a big mystery. The call is coming from inside the house, basically. So what we do with our patients is we take a very detailed history, we evaluate them from head to toe, we map their fascia, and we do all this with our hands to see if we can figure out what happened to your body and why is your body screaming. Because pain and dysfunction is your body's way of trying to tell you it's stuck. There's something wrong. It can't move. There's a problem. So what I did was I sat with myself and I said, self, what happened to you? And I came up with this injury and I decided to start icing my butt where I had fallen years ago. And what do you know? My hip pain started getting better. My back pain started getting better. And this led me to a series of reflective moments because it was the first part of pandemic. We can't do anything else but reflect. We can't leave our houses. And I started counting up the number of hours of treatment that I had done as a physical therapist. It's 31 years, and I calculated that I had been treating patients for over 40,000 hours of care. And you've all heard that at 10,000 hours, you're a master. So I started to kind of consider in my mind, okay, who am I at 40,000 hours of care? With what I do being that I sit with a patient and I analyze what's going on and I ask the questions and I'm digging deep. And I realized that at 40,000 hours of expertise, I have become Andy Cohen, the producer of Real Housewives. If you're not familiar with this show, What Andy Cohen does is produces a show of women, mostly, in different cities and states, and they have a high drama show for a couple of months, for a full season, where it's drama, 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 and by the end of the season, all the women hate each other's guts. There's usually a diva, there's a drama queen, there's an instigator, because drama makes good television. So you don't want boring women, you want, troublemaking women. And then at the end of the season, he sits everybody down in this nice little studio, and they're all dressed up. And he says, okay, what happened here? Because to have another season of Real Housewives, you have to bring everybody back into balance at the end of the season. So he goes person by person, and he talks to them, and he figures out, okay, who is the instigator? And who's just going along for the drama? Who actually has a problem that needs to be taken care of? And who is just kind of going along for the ride? So I realized that what I do with my patients is I'm moderating a Real Housewives reunion between all the arteries and veins and nerves and organs, and we take the time to figure out, okay, what's happening with your body? And then we fix it. So my invitation to you would be, if you have something going on in your body, try and harness your inner Andy Cohen. What is your body trying to tell you? Is there a part of your body that actually is in crisis and needs help? Is that the same part of the body that's screaming? It may not be. The loudest screamer isn't always the problem. And if you take the time to do a deep dive into your body and ask the right questions and take a history, what we've found with our patients over 30 years is that you can usually find an answer. And if that's something that's hard for you to do, find a practitioner. Find a practitioner who does acupuncture, naturopaths. Find a practitioner who's going to look at you as the full person you are with your entire history and ask you the right questions and get the details that they need to find, okay, what's wrong with you? What is your body trying to tell you? And then how do you fix it? To health.